My name is Anne and I'm currently working as a programme manager on the National Cancer Team at NHS England. My qualification originally was as a speech and language therapist in 1999 and I've taken probably not a particularly straightforward route to get to my current role, in that I became very specialised clinically in my specialist area of acute dysphagia management, and then decided to take a slightly different course to enter the role of sort of health strategic policy. In thinking about that change from the clinical role to a more strategic role, I appreciated that I didn't have as much experience as a project manager might have, for example. I didn't have the project management kind of qualifications that were asked for in, I think, virtually every NHS England job description, so I didn't have my Prince 2 qualification. I made the decision to apply for roles at a grade which was a lower grade than I had achieved as a clinician, but it felt like a sideways step which was worthwhile taking, because I feel as a clinician that level of kind of clinical leadership and clinical experience is really important and is needed at a strategic level. It was a big culture shock, and undoubtedly there were some challenges that I experienced, and some of those were things around learning the language that's used within NHS England, which I'd never had to kind of use before. And I think also the other thing which I think was new to me was just sort of understanding the vastness of the structures as well within NHS England and the wider arm's length bodies. On the sort of flip side of that, as an allied health professional, I think I was able to bring a lot of other skills which perhaps people who hadn't had my clinical experience wouldn't be able to bring to the table. So I think as a AHP, I'm hugely patient focused and I'm very practical. So I really understand what it's like to work on the ground. I'd had, you know, nearly 20 years clinical experience, so really understood the nuts and bolts of that frontline working. And so I think that enabled me to sometimes sort of say in meetings, well, that doesn't make sense, or sort of, how is that going to work? That's not going to work from a patient perspective, or that's not going to work from a clinician's perspective. In terms of actually doing the day-to-day sort of work. So almost a reality check, I suppose, for people. The other thing that I think we are, as allied health professionals, we're very good at analysing detail. We're very detail-driven. So on a clinical level, the detail matters. You can't, if you get the detail wrong, then you'll get your management wrong. And I think that level of analysis and detail is crucial on a strategic level. Early on in my career, somebody told me once every time you do something that's new or additional, to add it to your CV, so to constantly be updating your CV. And so that could be something to do with teaching, it could be something to do with research, it could be a presentation, it could be a publication, it could be a qualification that you've done. Whatever it is, add it and put it down. And that will help you when you're reflecting on your CV and you're trying to perhaps position your CV differently from a strategic or an educational or a research perspective. If you've got all those bits and pieces that you've done written down, it's going to be a whole lot easier to do it.